Hello and welcome to PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a diagnosis.
I'm Lita.
I'm Ron.
And I'm Jean Marie.
Collectively, we are the hosts of PodcastDX. This podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always ask the advice of your physician or other qualified healthcare provider for any questions you may have regarding a medical condition or treatment. And before undertaking any new healthcare regimen, never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
On today's show, we will be interviewing Gina, a liver transplant recipient.
Gina is a 48-year-old from the Chicago suburbs, where she lives with her husband, two teenage daughters, Nikki and Sarah, and their adorable puppy, Coco.
Hi, Gina. Thank you for joining us today.
Hello, thank you for having me.
I understand it's been almost 6 months since you had a liver transplant.
Yes, I was transplanted September 30th, 2017 in North Carolina at Duke University Hospital.
Well, you look great.
Thanks. I feel great. This is the best I've ever felt, actually, for a long, long time.
Super. Gina, what symptoms first led you to the doctor?
Well, as far back as I can remember, 2016, I had really bad swollen ankles from water retention, very tired. I was always cold. The doctors were thinking that I had cancer, which led my disease to worsen as they were testing me for cancer, but it was not.
How long did it actually take before you got the correct diagnosis?
My symptoms were bothering me for at least 5 months before they diagnosed my liver problem.
Gina, can you recall any specific symptoms that really stood out?
Yes, of course, my stomach. I looked like I was 9 months pregnant. It's a buildup of ascites. It's a toxic fluid that forms in your stomach, making it enlarged. My eyes were no longer clear. They were foggy. My skin was chapped and itchy, always thirsty, almost like you want to stick your head in the swimming pool. I lost my appetite. I had dry heaves, almost throwing up, but not quite. Always had leg cramps. My calves were so painful they'd wake me up at night. I would try standing up. They were very painfully twitching, and the muscles would cramp up. It's like a Charlie horse times 10. Very painful.
Terrible, terrible. Were there any embarrassing symptoms that you had?
Yes, actually.
So glad to see that.
Yeah, I had bad case of diarrhea all day. I would go maybe 8 to 10 times a day, never knowing when it would attack, but usually when I was at Target or Walmart shopping, and I would have to use a public bathroom for no reason at all. My nose would start bleeding, and it was on a daily basis.
Terrible. Did anything help relieve any of your symptoms?
Well, for the chills, I would layer up. I would layer clothes, use the electric blanket at night, wear socks, which I am not a socks person. I also spent time in the sun, which helped. I never used air conditioning or a fan, never wanted to cause a breeze my way because the chills, the feeling was intense.
You mentioned that you were always thirsty. How did you deal with the thirst?
Even though you're thirsty all the time, the doctor puts you on a water intake a day. So I was on a 2-liter a day intake of liquid. After my water intake, I would move over to a frozen Freezy Pops.
Sure, like a popsicle.
Yeah, because the popsicle had flavor to it and it would break up the monotonous taste of the water. Also, they give you a little sponge-like device at the doctor's office where you dip it in water and you kind of suck the water out of this little sponge, and that helped.
Did did anything help with the swelling that you had? You said your stomach was swollen?
Yes, actually, there's a procedure they call paracentesis.
Wait a minute, what is?
Paracentesis. You're in the hospital, outpatient procedure where they go in to your stomach with a needle-like device, and they hook up a hose to glass jar liters, and the fluid is flushed out of your stomach, out of your abdomen. Very painful, but when you leave after that procedure, you're about 5 to 6 liters of fluid down, where the relief is amazing.
So besides the paracentesis, was there anything else that you could do that would help the swelling?
Yes, you could watch what you eat, restricted salt diet, and limiting my fluid intake helped the swelling. At night, I would try to get comfortable by putting a wedge under my legs to help with the cramping. When the cramping got real bad, I tried to walk it off as early as I could. Sometimes when you check the sodium levels of the food that you're eating, you'd be shocked that a lot of things have sodium. So you do have to read labels and watch your sodium intake, because that will cause fluid to accumulate in your stomach. Also, I was a member at a health club that I had access to a hot water jacuzzi, which helped my legs in the cramping and feel less tense. I suggest that for anybody. And also, I self-meditate myself out of pain, and that helped me get through a lot of my symptoms.
Oh, that's really great. That's probably a good suggestion for anybody. Did you know what to expect when your doctors actually informed you that you had cirrhosis or
No.
end-stage liver disease?
I didn't even know, really. I've heard of cirrhosis of the liver, but I never really knew what it was or what it detailed. I assumed it was kind of like if somebody has a heart attack, you go into the emergency room, you get fixed, you undergo surgery, and that's the end of it. I did not know what end-stage liver meant, but they gave me weeks to live, and that was scary because you don't know what to expect day to day.
Yeah, you're 48 years old, and you're told that your time is just about up, and you were
Right.
absolutely healthy.
Yes, very
Very
scary and very sudden.
I understand that the hospital provided a number of classes to help prepare you for life with a new liver.
Yes.
Can you explain?
The hospital, they go over everything that you need to do to prepare yourself before transplant and what you need to do. It was terrible. At the time, you're so sick that you can't even concentrate on what they're telling you. My caregiver was with me, thank God, because she took notes for me. During these meetings, it's like a 3-day process where you meet different doctors and different people on the transplant team. It's very consuming. The information is very hard to understand because you're so sickly at the time. The toxins built up in my brain that the liver isn't processing, and I became very confused, and even I became combative.
Did you realize that you were confused, or when you were
No,
being combative, did you realize what
actually,
was going on?
when the nurse came in to check on me, she asked me a couple questions like what was my name and who was the president, what state do I live in. I answered Gina to all the answers, to all the
For
questions.
president. I
Yeah.
like it.
Yes, and she knew from being a liver nurse, she knew that was a symptom of toxin buildup in the brain. So immediately they put me to the emergency room and took care of me, and they had to flush the toxins from my abdomen.
Dangerous. Yeah. You're from Chicago, but your transplant was in North Carolina. Why is that?
Yes, well, I heard that some regions have faster results and you could register in more than one region. My caregiver told me about North Carolina because I was actually listed in Illinois, where I live, for over a year at Loyola University. When she told me about North Carolina and the turnaround and the fast transplant turnaround that they have there, I flew down, I got on their list, and I got on their list actually in August of 2017, and I was transplanted September 30th, 2017.
There's definitely a lot there. What would you say was the worst part of this process?
The worst part, it was waiting. Waiting to, you don't know when you're going to get the phone call for the transplant, getting sicker by the day. ascites and the fluid retention in my stomach, hurting, constant swelling, bloating. My legs were starting to give out because they were so swollen. Felt like my skin was going to rip open. There was nothing that they were prescribing me at that point that was helping me to get any kind of comfort. My sleep was lost. It was painful, actually, to even take a deep breath because the fluid was there was so much fluid in my stomach. It was pushing the rest of my organs up through my chest and caused hard to breathe.
It sounds awful. Did anything at all help with the swelling?
Well, doctors told me to wear compression socks, trying to stay positive thinking and moving about, staying busy with my everyday life. The swelling in my stomach, like I said before, was relieved through paracentesis. That was the draining of the fluid at the hospital.
Sure, right. How did you feel when you first got that call saying, Gina, we have a liver waiting for you? I bet that was a surprise, especially you say it was only a month after you signed up over at North Carolina. How did that make you feel?
Well, I was shocked when I got the call. I was actually at Walgreens picking up for a prescription, and they told me to go home, pack a bag, and go to the hospital right away, that they had a perfect liver. Well, I was excited. I was sad. I got very emotional. I think every emotion went through me. When I got to the hospital, yes, I was excited, but I had to wait for about 10 hours before they actually operated on me. So I had time for this information to sink in. Yeah, but at first, it was a shock, and I went through every emotion.
I understand that you were released from the hospital sooner than some people. What do you think? What do you think about that? What aided you in your recovery?
Well, I listened to my doctors. I did everything they told me. Actually, let me back up. I'm sorry. I did exercise a lot before my transplant, even though I was very sick. I had to try to build up muscle. They told me that after transplant, you would lose a lot of muscle. And I'm happy that I listened in that way because after transplant, you have to walk and build up strength. But I'm glad that I was physically fit before transplant.
That makes sense.
Also, I'm sorry, but also eating healthy as much as you can. You have to, a lot of protein, low sodium. I ate chicken and peanut butter, nuts, protein bars, protein shakes, anything with high protein that would build up muscle mass.
And did you have to take a lot of medication?
After transplant, yes, I was on 40 pills a day.
Wow.
And it was 4 times a day. So yes, when the pharmacy rep brought in the pill box the day before I got discharged, I said it looked like a fishing tackle box. I thought to myself, there's no way that I would ever understand this. I'm not a pill person, and I didn't think I could do it. But as time went on, I now fill up my pill box blindfolded, actually. But I'm down to 16 pills a day, so there is a big difference. Yeah.
That's a lot to swallow.
Yes.
All right, to be serious, since then, has anything else changed after the procedure?
Yes, I mean, I've learned that I have to stay very active. Walking is important. I wasn't able to lift anything 5 pounds or heavier, but now that I am 6 months out, I am able to lift 25 pounds and more. I mean, I have to watch what I do because they don't want me to get a hernia where the incision is. Absolutely, there's no smoking, no alcohol. Even sun exposure is considered high risk because of the medicine that I'm on can cause skin cancer.
And you have to keep an eye on your vitals?
Yes, every day I have to check my blood sugar because of the medicine intake can raise my blood sugar. I have to check my temperature, make sure there's no type of fever or virus going on. I maintain a healthy diet. And again, I do high protein and low sodium.
And were there any foods that you cannot eat? Or that now that you've had your procedure, is there anything that interferes with your medication?
Yeah, the grapefruit, you're not allowed to have any grapefruit or any product that has grapefruit in it. I was shocked to see that I used to use minced garlic in a jar, and I found out that there's grapefruit juice in there, some kind of preservative. And yeah, I was shocked. So you have to read every label. You have to make sure the product is dated, and if you can't read the date, don't buy it. Don't chance it. If you touch something at the grocery store and it's supposed to be cold and it's not, don't buy it. Also, I would always use right after transplant, when I was going to the stores or restaurants or out in the public, I would wear face masks and I would bring wipes and wipe down everything, handles of the grocery cart, even menus at the restaurant.
That's probably a good tip for everybody. Did anything make your recovery period easier?
While I was recovering at my house, I had a very great caregivers taking care of me. But also, when I was by myself, like taking a shower, I did use a grab bar in the shower. I did use the handlebars on the toilet seat to get up and down because you are still sore. Compression socks would help my legs from getting too swollen. Squatty potty would help so you don't have to, I'm sorry, but push while you go to the bathroom. You don't want you don't want any tension around that incision. Also, like I said, the antibacterial wipes are very good. Use them, Lysol spray, wipe down everything. Just be cautious, be careful, and you don't want to catch any germs if you can't help it.
Right. All of those products that you recommended, the squatty potty and the handlebars for the toilet area and the grab bar for the shower, will be listed on our website for purchase for anyone that's interested. And we'll be adding these products from the Amazon website directly for you so that you don't have to search too hard for these helpful products. Thanks, Gina. That was good information. What would you like our audience to know about the importance of being an organ donor?
Well, I personally was never an organ donor myself, but now what I have gone through, I totally condone it. I think everybody should be a donor. If anything of ours can help 2, 3, 4 people by being a donor, I say definitely do it.
That is an amazing story. Do you have any other advice for the listeners out there?
Oh, yes, I do actually. When you go to the doctor's office, make sure that you tell them exactly your symptoms. Like if you're feeling like you have a headache every other day or sore throat once in a while, just tell them everything that you feel, or tell them you're a drinker, or tell them that you do diet pills, or just be honest with them. You're there for a reason. They're not going to judge you, and possibly they'll test you, and before a disease occurs, they can help you and treat you.
That's great. Thank you so much, Gina. I want to thank you on behalf of the Podcast DX staff and our listeners, and we really appreciate you taking the time today to speak with us.
If you have any questions or comments related to today's show, you can contact us at PodcastDX@yahoo.com, through our website, where you can link to our Facebook page and also see more information as we build our site. Please go to PodcastDX.com.
And for our listeners, if you have a moment, please give us a 5-star review on iTunes Podcast